Okay, so you're really free to participate through chat just like last time. So students, our discussion is focused on diabetes, and we have learned that there are two primary types of diabetes. Of course, that's your type 1 diabetes mellitus, and then you also have your type 2 diabetes mellitus. The third type that we are talking about is your gestational diabetes, which is common among your patients, students who are of course pregnant. Class, ano ganing nga hormone? What's that hormone in pregnancy that increases the risk for diabetes? Answers in 5, 4, 3, 2. Samtang kapangita ko sa akong virtual background. Okay, there. Okay, chat box. Okay, class, that would be your HPL. Okay, so you have your HPL, class, or your human placenta lactogen. So take note that your human placenta lactogen is the one that increases the resistance towards your insulin. Okay, so class, main problem in diabetes, kahit saan man sa diabetes type 1, type 2, main problem goes back to insufficient insulin. Pero class, kung strictuhan ko gitang definition, sa ano nga types ng diabetes nga absent ang insulin? Sa type 1 or sa type 2? Very good. That would be in your type 1. Okay, so absent insulin would be in type 1 diabetes mellitus. That's why ginaliwat-liwat natin that the management for your type 1 diabetes mellitus would always be insulin. Kahit anong mangyari, class, you will start with insulin if you have type 1 diabetes mellitus. Whereas in type 2 diabetes mellitus, you have decreased insulin. Dahil decreased insulin lang siya, class, was the first line of pharmacologic management that we are using for this type of diabetes. Okay, sino nag-type sang HOA? Excited. OHA, class. Okay, your oral hypoglycemic agent. Okay, oral hypoglycemic agent. So that's your first line of treatment for your type 2 diabetes mellitus. Now, let's look at this diagram. I know you can create, no? I've seen your pathophysiologies in our case presentations. You can create a more detailed pathophys than this one. But I tried to make a simplified one, So what happens is that dahil class of insufficient insulin, there is inability of the body cells to utilize glucose. Okay, the body cells class could not utilize glucose. Therefore, the body students would perceive that there is a problem, okay, with the supply of glucose, and there would be what we refer to as your cellular starvation. Okay, class, there will be cellular starvation. And because of cellular starvation, your patient would experience polyphagia. It's just like that the body is thinking, I'm eating, there's glucose in my blood, but this glucose is not going inside my body. And because this glucose is not going inside my body, I need to eat more. Okay, that's your problem in diabetes. Now, because you're eating more, the tendency is that there will be increase of blood glucose levels. You can in fact indicate that there is increase of unused blood glucose levels in your bloodstream. Ang glucose hindi magamit sang lawas natin because of the lack of your insulin. And because of that, what could possibly happen? Okay, let's focus first our attention here. Okay, class, kay kulang or there is inability of the body to utilize glucose, the body would try to look for other sources of energy. Okay, mambal siya of the pigado si glucose, ngita tayban nga alternative. The next alternative that the body might think of is your lipolysis. In other words, class, your body, lipo means fat, lysis means breakdown. So your body will try to break down the fat. And kung break down ng fat, that would be a source of energy. But class, what particular byproduct of fat metabolism there could cause harm to our system? What particular? Okay, very good, ketones. So class, amuning problema ta because once your body would opt for fat breakdown or lipolysis, you have your ketones. Ketones would be coming in. Okay, that will be leading towards a primary risk factor or complication, which is your DKA, diabetic ketoacidosis. Now, also because students of the inability of the body cells to utilize glucose, there will be breakdown of glycogen in the process that we refer to as glycogenolysis. There is a process that we refer to as glycogenolysis. Now, because of glycogenolysis, there will be a breakdown of glycogen going towards glucose. Ano naman ang goal? Para lang class may gamiton nga glucose ang aton nga cells. But ang bottom line, hindi man sa gyapon magamit sang cells na kay kulang insulin, so it's adding insult to the injury which is caused by your increased blood glucose levels. Next, there will also be protein metabolism. What do we mean class by protein metabolism? You have the process of gluconeogenesis. If you look at the word genesis, it would mean make up, no? It would mean making glucose molecules from the unusual sources, as we call it. From the unusual sources, as we call it. What are these unusual sources, guys? So you have your protein. Okay? Imagine na class protein is not a usual source of glucose, but liver could be able to process your protein to make glucose out of it. But this leads to negative nitrogen balance, blood urea nitrogen, increase of your creatinine, and then even your muscle wasting. Nga class muscle wasting, if you would look at our muscles, what's the main macronutrient found in our muscles? Main macronutrient found in our muscles are your, sige nga, let me see. Okay, very good. Amino acids and your protein. Okay, class, your protein. Muscles are made up of protein. So for that reason, pag walang source of energy, pati si muscles natin, class, ginagamit sang lawas natin. Okay, that's why you would have muscle wasting there. Now, let's go here. Tanan nga to class, nag-lead sa pag-increase ng blood glucose. And because of the increase of blood glucose, there will be increase of blood osmolality. Okay, nag-increase ang concentration sa ating blood brought about by the glucose levels. And because of that class, there will be increase in blood viscosity. Okay, the blood would become more viscous, leading towards impaired circulation and also proliferation of your microorganisms. That's why one risk factor that you have, or one complication, that you have for diabetes is the presence of infection. Now, dahil class nag-increase ang blood osmolality, isa pa gid ka-effect is your glucosuria. I've introduced to you, I think, the term renal threshold. Okay, renal threshold. What's the renal threshold? Students, for glucose. What's the renal threshold for glucose? What's the value for the renal threshold for glucose? Sige nga, pila ka milligram per DL, guys? Renal threshold for glucose. How many milligrams per deciliter? Daw ay may nagasabat how. Okay, may nag 180. Okay, going up, going down. Nga, may question mark. Okay, I like the symbol approximate. Okay, class, so your renal threshold is playing at 180 milligram per deciliter. So class, ano na means ang renal threshold? When I talk about renal threshold, students, that means that is the capacity of sugar that your kidneys can handle. That is the capacity of sugar that your kidneys can handle. Now, beyond your 180 milligram per deciliter, guys, your kidney will be excreting the excess sugar. The kidney will be excreting the excess sugar. For example, pag nag 200 milligram per deciliter ka na consistently, it's already beyond the renal threshold. So what your kidney would do was that to excrete the 20 milligram per deciliter. So class, it simply means nga, kung may ara na sugar na makita sa urine ng pasyente, it would mean that the sugar of the patient in the bloodstream is already very high. Okay, the sugar of the patient in the bloodstream is already very high. Now, because of that, students, there will also be osmotic diuresis. Okay, now, define osmosis. What is osmosis, guys? Is it the movement from an area of higher pressure to an area of lower concentration, a higher concentration to lower concentration, or lower concentration to higher concentration? I can see one, low to high, high to low, higher to lower. Are you sure? Okay, osmosis. Is it H to L or low to high? Osmosis. Sige, ibilin ko na siyang assignment sa inyo. Bilin ko na siyang assignment sa inyo. Doon namin na siya pa assignment sa inyo. Para you would read back to your fluids and electrolytes and then read about osmosis and diffusion. Okay, osmosis versus diffusion. One talks about the movement from low to high. The other talks about movement from high to low concentration. But anyway, for this discussion, let's just think that water has the tendency to follow glucose. Water would have the tendency to follow glucose. That's why, class, kung nagaupod na dito gwa no, ang sugar natin sa urine ng pasyente, the tendency is that this sugar would be going also, or the water, I mean, would be going with your sugar. And for that reason, we are seeing our patient with polyuria. Now, other than the polyuria class, okay, which can lead to dehydration, the increase of blood osmolality could also lead class to your ICF dehydration. It leads to your ICF dehydration. Kay tamaan ka concentrated ang plasma students, the tendency is that the water would escape from the cell going towards the plasma. It would escape from the cell going towards the plasma, which means that the cells are getting dehydrated. So duha ka factor nag-lead pa kadto sa dehydration. So ang pag-increase ang blood osmolality kag ang polyuria naton would lead to fluid volume deficit. And with that, the body would try to compensate. Okay? What is the thirst mechanism, or what is the thirst center of our brain? Thirst center of our brain. Okay, good entries. That would be your hypothalamus. Okay, class, the third center of your brain is your hypothalamus. So pag na-feel nga, oops daw, dehydrated kita, mambal sa hypothalamus, sige, drink, leading towards your polydipsia. So in a new onset diabetes mellitus students, you would notice that the 3 P's would come in order. Okay, the first P that would come would be your polyphagia because of cell starvation. That would be followed by your polyuria, okay, because of osmotic diuresis, and then polydipsia because already of dehydration. So again, in new onset diabetes mellitus, this is the usual order of the occurrence of 3 P's. So kung pamangkuton nyo na history ng pasyente, una mahambal nang wala man na sa ibang ginabatsyag sa una, sige na panginaon niya. Tapos daw a month ago, to sige na pangihi iya, bisan alas 10 sa gabi, alas 12, alauna, gabangon, mangihi. Tapos subong naman, iba naman ginabangon niya, nagainom naman siya tubig. So that is how usually they would narrate, no? If you would look at the history of present illness or the progression of illness among patients with diabetes mellitus. Now, diri sa kilid. Guys, gamay lang ng lista sa kilid gana, pero kung tanawon nyo na sa libro, that's a lot of topic already. Okay, because that talks about the complications of your diabetes. Now, let's look at it. You have your CNS. So class, for the central nervous system, okay, your diabetes could also lead to stroke. Okay, uncontrolled diabetes class could lead to stroke. Why? If you would look at it, students, if there is increased sugar levels, okay, that would lead to other than the increased sugar levels, nag-increase sugar levels plus the fact pa class that lipolysis would be ongoing, there would be an increased levels of fatty acids in the bloodstream. Class, pag nag-increase ang fatty acids sa bloodstream, diin ma-deposit ang fats natin. Where would the fats be deposited? Or where would this be fatty acids deposited? Blood vessels, specifically class in your blood vessel walls. At kapag nag-deposit na siya class sa blood vessel walls, what do you call that condition? What do you call that condition? Sclerosis, medyo malapit. Okay, you have your atherosclerosis. Okay, your patient students would experience already atherosclerosis. Now that the patient is experiencing atherosclerosis, if you would review the pathophysiology of atherosclerosis, you would realize that atherosclerosis, guys, would also be leading towards thrombus formation. Kaya ang tendency, ang aton nga mga blood, nag-stay dira sa mga atherosclerotic na parts ng aton nga blood vessels. Clot formation, okay, ay una muna clot or thrombus formation. That's correct. And then your thrombi could travel and become an emboli. And then to cut the story short, that could lead to stroke. Okay, that's one problem. Another problem is that because of diabetes, there would be narrowing of blood vessels. Because of the narrowing of the blood vessels, guys, it could possibly lead to your ischemic stroke also. The narrowing of your blood vessels could lead to your ischemic stroke. Now, CVS, okay, in their cardiovascular system, you could have your CAD, okay, coronary artery disease. The explanation of this would go back to your atherosclerosis. You would also have cardiomyopathy, and that is because of the decreased blood flow going towards your coronary circulation. Okay, decreased blood flow towards your coronary circulation. You also have your PVDs, peripheral vascular diseases. Okay, so class peripheral vascular diseases, anong kakatabo? The blood supply going to the peripheral aspects of the body are decreased, and because of that, that would usually lead to slow wound healing. Okay, slow wound healing. And then you would have infection. Okay, students, the most common cause of my diabetic patient getting admitted in the hospital is infection. Particularly, we are referring to your DM foot, no? Okay, we are referring to your DM foot. Let's see kung may DM foot ako kung pakita this sa inyo. Amo giniya class ang usual. Kag makita mo na sila guys, halina sila sa mga kaumahan usually. Again, wala kita ga-judge, but by experience, people there would usually seek the consult of the physician if it's already too late. Okay, so class makadto na sila sa imo tapos mahambal, ay dugay na naakon infection. Okay? Or hindi gani class kisan nag-umpisa sa ingrown. Nag-umpisa lang siya sa ingrown, naglala siya class, tapos nagpadayon siya, nagamuna na itsura niya, leading towards necrosis. Okay, leading towards your necrosis. Okay, that's how severe your diabetic foot could progress. That's how severe your diabetic foot could progress. That's why students, bisan magambal lang nga ingrown na iya, if you're dealing with a patient with diabetes, dapat i-manage na siya properly. Kaya dira sa ingrown nga na guys, your patient could lose his entire lower extremities. The entire lower extremities could be lost. Now, oftentimes mambal na sila, nurse wala ta may mahimo ut doon na sigurong kamalagko, no? Kay for example, class kung amo ni, oftentimes abis ang pasyente hasta lang diri ang ut doon. Okay? Abi nira dira lang hasta nga part ng ut doon. But guys, that would vary or that would differ depending on the part of the blood vessels affected. Kung ako students magtulo, kung mag-amo sini for example appearance niya nga necrotic na siya, class damo na nga blood vessels affected. Usually your patient needs to undergo BKA. What is BKA? What is BKA, guys? Okay, below the knee amputation. Your patient would need to undergo below the knee amputation. Okay, BKA ha. Okay. Now, so infection, no? Students usually mahambal sila sang infection nila. Ang common pagida nila nga history is that gin-manage ng ilang infection for 7 days tapos wala gid na resolve. Okay, 7 days tapos wala na resolve sang oral antibiotics. So usually they need to be started on IV antibiotics. Next, complication of your diabetes, you have your nephropathy. Okay, so class nephropathy, kung wala ko pa nahambal sa inyo, this is also the number 1 cause of dialysis among our patients. Okay, your DM nephropathy. So class magambal ako nga DM nephropathy because ang damage ang blood vessels, nagagamay ang blood flow pakadto kay kidney, si kidney naton class naapektuhan, nagamat-amat increase ang creatinine until your patient would have chronic kidney disease. By the time patient is having already class chronic kidney disease, it's your patient would need to undergo dialysis. Eyes, retinopathy. Okay? So kung pamangkoton gani kamo sa board exam, patient is experiencing blurring of vision. A patient with diabetes is experiencing blurring of vision. What complication will you explore? That would be your retinopathy. Now, if may kita pasyente nga diabetes students, how frequent do we want them to visit the ophthalmologist? How frequent should they be doing a visit to your ophthalmologist? Every ano guys? Sige nga. Every 6 months. Okay, every 6 months. Sige. Class, the recommendation is at least once a year. They should see an ophthalmologist at least once a year. Now, what is the common misconception among your patients? They tend to confuse an ophthalmologist from an optometrist. They tend to confuse an ophthalmologist from an optometrist. Okay, let's make a quick difference. Who makes eyeglasses? Ophthalmologist or optometrist? That would be optometrist. Who would be concerned about the internal structures of the eye? Who would be concerned of the internal structures of the eye? That would be your ophthalmologist. Okay? Pero students, hindi lang kamo magambal nga sir manug-ubra lang galianti parang mga optometrist. No, that's not their job. Ano? Basically class, they're talking about errors of refraction. So you would be talking about your nearsightedness, farsightedness, astigmatism. Your optometrists are the best people to address that. But if you'll be talking about retinal damages, macular degeneration, that would be your ophthalmologist to best address the concern. So in our case here, it is the retina that is our main concern among our patients with diabetes. So you would need to consult an ophthalmologist. Gastropathy. Class gastropathy, because of decreased blood flow towards the stomach function is also affected or depleting, and because of that, it leads to gastropathy. Una-una, ma'am, bala ng pasyente daw, hindi ako matunawan, how? Nga nurse feeling ko, permi daw gabutod akon tiyan, how? Okay, those are already signs of your gastropathy. Okay, those are signs of your gastropathy. Okay, now, neuropathy. Plus, neuropathy is brought about by poor nerve innervation. So, ano ang pwedeng maging complication? Neurogenic bladder, erectile dysfunction, pwede man class numbness, pwede man nga tingling. Pag pamangkuton ka mo kung ano ang classic nga signs and symptoms sa isa ka pasyente nga may neuropathy, guys, that would be numbness and tingling. Okay, magambalabi. A patient has diabetes for 2 years, poor sugar control. The patient is experiencing numbness and tingling. What complication? That would be your neuropathy. Plus, if my patient would be undergoing neuropathy, numbness and tingling, anong usual nga vitamins ang ginahatag naton sa ila? What's the usual vitamins that we will be giving our patient? Okay, very good class. Your B complex. Okay, not just your vitamin B12. This is not pernicious. Okay, but class, you need to have your B complex. So the complete set of your vitamin B. Okay, neurogenic bladder. Bladder class fully distending, not able to detect that it's already full. Okay, so it's either class, it would have poor control, kisa hindi mapunggal sa pasyente nga mangihil siya. That's an effect of your neurogenic bladder. Erectile dysfunction class, this is perhaps the erectile dysfunction that could not just be managed by having your Viagra. This is the type of erectile dysfunction nga hindi lang class basta-basta ma-manage sa inyong sildenafil or Viagra. So that's why students, diet is very important, especially magambal na sa uling pasyente. Nga hindi na kuya kabatsyag, no? Hindi na ko kabatsyag when we will be having our sexual act, no? So class, that is a possible complication already of diabetes. Other than that, may mga bulong man sa hypertension kag diabetes that lead to erectile dysfunction. So dapat siniklas dietary lifestyle modification. Nagabalik ni sila tanan students sa pag-decrease ng blood flow. This all go back to the decrease of blood flow going towards the specific part of the body. Okay, so those, plus a lot of things could happen to a patient with diabetes. But if your patient is able to control, okay, the prognosis of a patient with diabetes is actually very good. They could live a normal lifespan if they are able to control. But if they don't have discipline, if they are unable to control diet, lifestyle, it's very less likely students that they will have a good quality of life. Okay, mortality is very high within 10 years among patients, guys, who have poor control of diabetes. Okay, class damo ng organs pwede maapektuhan. At times they will come in the ER, yellowish na sila. Liver gali class already affected. At times they would come in the ER, nag-ooze ilang nga dugo class, tapos may mga baho pa nga mga pus. Okay, because of infection that is non-healing. Okay, so that's why we always go back and say nga dapat i-manage it properly. Okay, so you have a lot of laboratory tests there, but I would just want to focus our attention here on HbA1c. Class, your HbA1c is also known as your, another name for your HbA1c is glycosylated hemoglobin. Glycosylated hemoglobin. Guys, as you can see in the handout, the goal for, the normal value for your glycosylated hemoglobin is 4.4 to 6.4%. Okay, 4.4 to 6.4%. Pero look at class the diabetic goal, less than 7.5%. Ang goal ta for diabetes is less than 7.5%. Now, you might be thinking, amo niyang normal, pero amo niyang goal ta sa diabetes. What do we mean by that? If your patient class is already diagnosed with diabetes, okay na nakita class gang iya blood sugar is less than 7.5%. Once kasi students nga ang pasyente nga may diabetes, ang iyang glycosylated hemoglobin class, maglubo-nubo gid abi, for example, mag 5.5. Okay? Manimag-una na sila ya class, their body is not accustomed to that, and they will be at high risk already for hypoglycemia. Okay, they will be at high risk already for hypoglycemia. And damo man nga pasyente sa ER with diabetes are coming in because of hypoglycemia. Why are they having hypoglycemia? Because of the misconception that mambal na sila nga, ay may diabetes ko, hindi ko guro magkaon. That is a very wrong notion. Okay? Class, kung may kilala ka mo nga diabetes, if may parent ka mo nga diabetes, if your parents, students will be having long travels, make sure nga may dala ka mo nga biscuit, make sure class nga may dala ka mo nga source ng sugar, or kung wala na lang gid class, may dala ka mo nga 20 pesos para makahapit ka mo sang Coke sa Changi in kaso nga magka-hypoglycemia ang inyong pasyente. If I have not yet mentioned to you, maybe this is the part class of the board exam wherein you can answer soda. Okay? If a patient, for example, with diabetes is experiencing diaphoresis, diaphoretic siya class, pagkatapos ang pasyente naton, for example, nagakudog iya kamot, there's presence of tremors, okay, you would suspect that the patient is having hypoglycemia. And because of that, you could have your rescue sugar. Kung NCLEX na sabtan nyo, masabat na sila rescue tablet or rescue sugar. Okay, para mga NCLEX, mga rescue sugar kasi sa mga US of A. Pero kita diya class, kung wala ka na iban nga sabat, so you have your soda. Okay, this is the time siguro nga pwede nyo isabat inyo nga soda. But if ara pa class sa option ng juice, have your juice. If ara pa sa option ng 1 teaspoon of sugar, choose of course your 1 teaspoon of sugar. If you would look at actually the equivalent, one can of soda is actually equivalent to 1 teaspoon also of sugar. That's how heavy the sugar there is. Okay, now going back class to HbA1c. So take note that your HbA1c would evaluate the serum glucose levels at 3 to 4 months. Evaluate the serum glucose levels at 3 to 4 months. That is class commensurate to the lifespan of your RBC, which is 90 to 120 days. Okay, 90 to 120 days. Kung pamangkoton ka mo, what laboratory test is best used to evaluate compliance to treatment and effectiveness of treatment, and then control of sugar, that would be your HbA1c. So compliance, control, effectiveness, balik na tanan kay HbA1c. Yes, that's right, HbA1c. So class, urine glucose and urine ketones, glucose in the urine is not expected. But once there is glucose in the urine, it means that there is too much sugar in the bloodstream, that it exceeded already the renal threshold. And because of that, your patients are having manifestations of glucose in the urine. Sige. Other class nga lab parameters are also indicated here. So class, hindi ka mo basta-basta kahambal, no? Nga ay, pagkuha ko sang blood sugar sang pasyente, 150. Siguro ang pasyente ko may ara sang diabetes. No. It does not equate like that. No? It does not mean like that. Ha? Hindi na siya class right away nga diabetes siya na yun. Okay, so there are parameters that needs to be looked into. So look at this, HbA1c, fasting blood sugar, 2-hour plasma glucose, and then class symptoms of BM, plus the RBS of greater than or equal to 200 milligram per deciliter. This criteria is based on, I based this on a medicine textbook, and the latest that I could find so far. Now, diagnosis, kadamo sang nursing diagnosis for diabetes. Okay, you can start by saying imbalanced nutrition. You can start by saying that there is risk for infection, ineffective peripheral tissue perfusion, ineffective cardiac tissue perfusion, depending on the signs and symptoms that your patient is experiencing. Can even say acute pain. But by the way, kinamit lang ko ang pain. Class, what do you think happens if your patient is having DM neuropathy? Is the pain sensation increased or decreased? DM neuropathy. Is the pain sensation increased or decreased? Okay, class, reminder, gid nga dako ha. It's the pain sensation is decreased. Ha? Pain sensation is decreased. So, ibig sabihin, class, anong mga implications, no? Posible ba na ayan, class, kabisan may pilas sila, hindi nila mabatyaga. Okay? Yes, that could possibly happen to them. Okay? That's why hindi nila yung class mabatyagan, mambala sila, uy, napilas ko gali. And then, class, is it wise to use hot water bag among these patients? Okay, no, kid. Ha? No. Dealing with elderly, dealing with diabetes, don't ever use your hot water bag or else students that would result to burn. Okay? Maambal, abikis tibalaan mo, sir, butod iya chan, ti ambal dito sang una, ang hot water bag kinahanglan naton para sa chan sang aton pasyente. So it is not of help. Okay, it is not of help. Ha? So, hindi ka mo klas magambal nga amo na ang bulong sa butod sang chan kay kung kakaron kung mag-burn ang abdomen sang aton nga patient, once ma-burn ang abdomen sang aton nga patient, okay, you will be at risk for no, I'm thinking of a term, negligence. Ha? You will be at risk for negligence. So kindly take note of that. Okay, next. Sige. So here are other criterias, no? So you have the criterias there indicated. Planning, intervention, and evaluation. Here's one thing that you need to emphasize to your patient. Masakit man na hambalon sa ila, but there is no cure for diabetes. What you would want in diabetes is control of blood sugar levels. So that's one of the emphasis. There is no cure, no? There is only control. Next, diet. Okay, so you need to have proper diet, balanced diet. Again, need gid emphasize class ang tinaga nga balanced diet. Kag kung nag-educate ka mo sang pasyente nga may diabetes, tell them specifically not to skip meals because their tendency is to skip their meals thinking that they will cure their diabetes by lowering their blood sugar through skipping of meals. Pag skip na nila class ang meals nila, hypoglycemia. Hindi nyo man kinahanglan hambalon sa ila, pero as nurses, we know na kung hypoglycemia pabayaan tayo, you can rest in peace. Ha? So you need to be careful with that. So class, oftentimes, our education for our patient is, anong diet? Pila ka meals in a day for a diabetic patient? How many meals in a day? 3, tapos dagdagan natin ng how many snacks? How many snacks? 2 snacks. So class, we always say 3 meals and 2 snacks. Pero class, maghambal kita nga meals, it does not mean nga meals ang panday nga nag-ubra bira-bira sang isa ka semana. Ha? So class, maghambal kita meals, mambal nga si Doc 1 cup of rice. Paghambal ni Doc nga 1 cup of rice na students or pag-advise ang dietitian nga 1 cup of rice, hindi na pag-updan sang isa pagid ka slice ang loaf sang bread. Because 1 slice of a loaf of bread is already 1 cup of rice. Guys, amo na yung common sa Filipino setting. Mambal, yung nga mamahaw ta, kay kang gina pandesal malang ginkaon naton. We fail to recognize that your pandesal is already equivalent to 1 cup of rice. So if you're dealing with a diabetes patient, mambal, para dayon, okay, 1 serving sang karne. Ang 1 serving niya klas sang karne nga ginanamin naton daw puspro kadako, daw matchbox kadako. Ang ilan na yaklas 1 serving sang typical nga Filipino family, isa na yaka daw yahong nga gabay. So you need to educate them kung ano na mintas ang 3 meals and 2 snacks. May pasyente ko na yung mga balaan mo na gid nga taas sugar ko, pa snacks mo pa ko kaduha. Okay? So class, you need to educate them if what is the purpose. Why are these food products spread across the day? Why are they spread across the day? So class, isa ka reason sina is to ensure and to prevent hypoglycemia, to ensure adequate glucose supply and to prevent hypoglycemia. Now, exercise. Ara naman, kung bala mo na sila class ng exercise, daw is as if bala tomorrow morning, daw ma-model na sila kung diin-diin, bira-birahan naman ang nila exercise. So dapat you need to educate them that the exercise should be done gradually. There should be gradual decrease. There should be a gradual increase, of activity. Hindi pwede class nga subong nga adlaw, hindi ka athletic for 20 years of your life, tapos pag tomorrow morning bira-birahan mo exercise. Okay, that could not be, ha? That could not be. Now, laboratory monitoring. Students, for your laboratory monitoring, this needs to be done every 3 to 6 months for the acute phase, every 3 to 6 months for the first diagnosis of your diabetes, and then every year once sugar control has been attained. Every year once sugar control has been attained. Now, may mga excited ka muna nga pasyente, no? Subong taas-taas, abi FBS ya. Pagkasunod si Mana, mamangkot na siya. Di pwede na kita ka-retake sang FBS, kaya nakaumpisa naman kita bulong. So class, the answer for that is no. Okay? The answer for that is no. Bakit class? How many weeks na? How many weeks do we need for the laboratories to normalize its value? For the laboratories to normalize its value. Okay, 4, lucky number 4 kamo yan. Okay, 4. Okay, so it's at 6 weeks. It's at 6 weeks. Excuse me in a little while, please. Now, so class for your FBS, okay, so it would take around 6 weeks for the laboratory values to be normalized. So dapat you should educate your patients about that. Okay, I had a question earlier. Dali lang, copy ko to. So there is a question, let's read. When a patient with controlled diabetes is admitted, we order for FBS and HbA1c. Is ordering for urinalysis necessary? Students, actually, it would depend on the case of your patient. If your patient is manifesting signs and symptoms of urinary impairment, urinalysis would be necessary. Other consideration to that is that urinalysis is usually part of an admission workup. When I talk about admission workup, here are the laboratories usually ordered upon admission. CBC, depending on the case, we add platelet. Then we also do sodium, potassium. We do BUN and CREA, but priority is CREA. And then we also do SGPT, SGOT. Then we do the 3 fasting laboratories, FBS, lipid profile, and uric acid. And then class, you need to have your chest x-ray, PA view, and then you have your urinalysis and fecalysis. Guys, sorry for writing UA and FA. UA and FA are not actually universal ng mga shortcut, but that is how it is usually written in the clinical setting by your physician. So it could be, no? Based sa question nga ni, nalipat na mo sino namangkot. So class, based on this question, we order for FBS and HbA1c. FBS, kung diabetes na siya class, pangayuan gina siya FBS. Kung HbA1c siya, HbA1c depende. Kung bago lang siya class gin-manage, let's say for example, last month lang siya ginabulong sang iya nga diabetes, hindi siya kinahanglan ng HbA1c this month. We would wait for 3 to 4 months of therapy before HbA1c values would be altered. And then class, for the urinalysis, to answer the question, so it could be part of routine admission workup, or it could also be because the patient is having urinary signs and symptoms. Pleasant afternoon. I have a question. What if si patient? To kanami, dili ko may question na. Sige, dapat may mga dear Tito Porks. What if si patient unconscious siya because of hypo? So hindi na di ba pwede sir ang sugar or juice to avoid aspiration? Ano ay hanang pwede obrahon? Okay? That's a very good question. Class, kung ako na pasyente, number 1, I will pray for the patient. But kidding aside, guys, so what could you do? You need to bring the patient to the hospital. Okay? Very good, ha? Okay, class, so you don't use your sugar, you don't use your oral sugar if your patient is unconscious. That's a big no-no. Okay, that's a big no-no. Okay? So class, to avoid, that's true, aspiration. So class, anong obrahon? Patient will be going to the ER, I mean. And what would be given in the ER? Palagay nyo class, anong bibigay sa ER? B? Anong B? Anong B? Magulo. Do, abi ko nag-ABCD. Nagtulok man ko kung may ABCD ako diri sa akon nga papel. Okay. So class, it's okay. That will be your D50. And then very good also class on your glucagon. Somebody mentioned glucagon. Glucagon is given IM, and then class you have your D50 given IV. Ang usual gid nga ginahatag ta class is D50 IV. Kay D50 IV. Okay, napaisip ako tuloy kung ano yung D. Okay? So, yeah, thank you for that. That's actually a very good reminder for you to be prompted that if your patient is unconscious, you are not supposed to give your oral sugar. Okay, you're not supposed to give your oral sugar because class aspiration is more deadly than hypoglycemia. Okay, now where were we? Pharmacologic therapy, we'll pass through that in a while. Now, goal of dietary plan. The plan class is a diet consistent with the insulin resources of the patient to achieve the body goal weight. And then, class, we prevent the sudden reduction of a diet for a patient with diabetes because hypoglycemia could lead to coma. Okay? No, gid class nga magambal 24-hour fasting. Nga class ginsulat ko gidang no 24-hour fasting because mambal ng pasyente abwas mapalaboratory ta. Ma-fasting ta brati 24 oras lang tawon ta kung hindi magnormal. Okay? That's a very wrong notion. Pag amo na class sobrahon nila pagabot nila sa ER kiwi bibig nila not because of diabetes but because already of hypoglycemia. Okay? So goal class is to regulate the diet but not to reduce the diet or omit the diet. That would even students go back to the management of your obesity. Kung na-notice nyo class sa obesity, wala bala class gahambal sa obesity management nga gulpi mo lang i-absent ang isa ka diet mo. Kaya or gulpi lang class nga i-decrease mo ang diet mo. Ano class gulpi nagakatabo? Let's say for example masigway kita gamay. Kung ang obese naton students nga patient, kung baga amo ni kataas ang kaon niya always, tapos tomorrow morning, when he wake up, na-realize niya, do katambok sa akon, gulpi siya class nag-decrease ang iya intake. The possibility is that masustain niya na class in a week or so, tapos mabira-bira naman na sa class kaon. Okay, so the same way in our students with diabetes. Dapat gradual ang pag-decrease naton sang diet nila, tapos i-maintain naton sa levels class na suitable para sa ila. Okay? Not just na i-omit kid naton ang sugar sa ilang diet. The ADA guidelines are indicated there. And then class, your simple sugars are not recommended. Okay, si cake, si pastries, cookies, soda, gum, candy, table sugar, honey, molasses, not recommended. Your complex sugars class are recommended because your complex sugars allows for adequate amount of sugar to be slowly processed by the body. Okay, to be slowly processed by your body. Okay, so class ara si rice, si bread, si pasta, kag si fruit crops. Ha? Now, basi karon ba ison nyo? Sir, ambal mo kayo na, pwede ang soft drinks. Class, pwede to siya si soft drinks kang gina kung hypoglycemia. Subong ya class istorya na kita diabetes. Okay, so exercise goals are indicated there. 60 to 75% of maximal heart rate per age. Hindi pwede class ang rigorous exercise. Basi karon nag-diabetes, siya makita mo nag-weightlifting na to siya sa gym. That's a no-no. Tapos class 20 to 45 minutes per week lang, kag minimum of 3 times a week. Class ang gusto ta di consistency. Bisan maghambal lang ang pasyente mo nga ay galakat-lakat ko ti 20 minutos kada adlaw, okay na class. Ha, rather than wala gid siya nagalakat-lakat. Okay? Now, what are the effects of regular moderate physical activity? Decreased blood glucose, weight reduction, naga-increase ang insulin sensitivity if sa type 2. Tapos class decrease BP, kag decrease stress and tension. Okay? Now, before exercise, 5-minute warm up, tapos check blood sugar. Always remind them to bring rescue candy. Kung taga-umaklas ang istorya mo, hindi ka magambal, sir, dala ka rescue candy. Kaya kung kakaroon class magkadto na siya sa Changi, wala na dito sa rescue candy nga hatag sa iya. Hambala mo siya, sir, dala ka sang dulce nga matamis. Ha? Okay? That will be your rescue candy. Now, include 5-minute cool down at the end and then check naman blood sugar levels. Now, insulin therapy. So, insulin therapy, guys, needed for type 1 DM. Okay? No argument on that. Type 2 DM class nga wala nag-respond sa OHA, pwede kitagaan na sa ulihis ang imong insulin. And if that class type 2 DM during acute stress. Example, na-admit sa hospital, infection. They need insulin. Or for example, type 2 DM, kailangan operahan, they would need insulin. Because the insulin class na gina-inject is easier to control and manage compared to your oral hypoglycemic agents. Okay? Now, those patients also in NPO, they need insulin. Now, kaya nadumduman ko lang no, kay common man nga pamangkot sa akon sa una sa mga pasyente. Kaya ko class operahan na sila. Di ba kung diabetes, kina-educate na sila, sir, hindi gid mag-skip sang meals kay mahay puglay, ikaw sila. Tapos pag operahan, gin NPO sila. Mambal daw ng pasyente sa imuti, nurse, diin ako makuha sang akon nga sugar. Kay hambal yung man sang una, kung hindi ako magkaon, mahaypoglycemia ako. Tangtaha ang pasyente ta will be undergoing surgery. Ginbutang ta sa NPO. Diin siya class makuha sang source sang sugar. Okay, very good. If you can notice, guys, you will have IV containing or dextrose containing IV fluids already for your patient. Okay, you would have dextrose containing IV fluids for your patient. So usually makita nyo na si D5LR, makita nyo na si D5NSS. Ha? So class mambala si Dr. NPO post midnight, insert D5NSS 1 liter times 8 hours. Okay, parang ganon. Types of insulin. Arada class kadamo sang types ng insulin kag tapos kada libro na galain-lain na kisa class may ara nga mahambal 30 to 45 minutes, may ara naman nga 60 minutes to 1 hour. Okay? Class, for the sake of the sorrowful passion, class, for the sake of your board examinations and also your practice later on, please memorize the onset of action, the peak, and then the duration. Okay? Kinanlano nyo na class. Now, pag pamangkuton ta kamo, when is the highest likelihood for hypoglycemia? Is it sa onset of action, sa peak action, or dito sa duration of action? Daw karong matayas ang option C, no? Okay, sige lang para may choices. Okay, so class, that would be on your peak action. Ha? Mahambal na abi, no? Mga common ang scenario mahambal. Nurse Olaf has injected insulin at 7 a.m. Regular insulin at 7 a.m. Okay, what time is hypoglycemia most likely? Regular insulin ko at 7 a.m. When is hypoglycemia most likely? Sige nga, regular insulin. Okay, that would be between 9 a.m. to 10 a.m. Very good. 9 a.m. to 10 a.m. Okay, sabi na yung halin, hari klaso, 2 to 3 hours. Ha? 2 to 3 hours. Okay, T30 dito lang sa pakanon sa 9 to 10 a.m. Nga usually gahambal kita nga dapat mag-inject kita insulin ara ng pagkaon. Take note of this class ha. When you inject insulin, the food of the patient should already be in front of the patient. Dapat class makagat na lang gid ang pasyente pag inject mo sa insulin. Why is that so? To prevent also hypoglycemia. Timambal kamuti, sir, dapat bala nga dito ko siya pakanon alas 9. No class, dapat pakanon mo gid siya the same instruction. Kay you inject your insulin right before the first bite of the patient. Kay nga class pagkaon naton class, hindi man na right away makadto sa dugo naton ng aton kinahon. It would also take time in our GI for the food product to undergo its transit and then to be converted to your sugar. Okay, so take note of that. So class, please tuparan nyo ni Danay karon sa gabi kag memorization ha. Okay, pangitain nyo paagi nga bisan makasandad kamo madumduman nyo gid ang mga values na ina. Now, storage of insulin. Class, your insulin is stored. Okay, your insulin is stored in a refrigerator for the regular insulin. Stored in the refrigerator for regular insulin. And then class, it's stored in room temperature for insulin in second or third in the succeeding doses. Daw karong gramaring. Pero class, ang punto lang man, insulin is placed in the refrigerator if it is not yet opened. By the time class that is open, it is already placed on room temperature. Okay, it's already placed on room temperature so that it will be comfortable on the part of the patient by the time that you will be injecting it. Okay, so that's it. Now, syringe. Students, when you are injecting your insulin, you are supposed to use your insulin syringe. Okay, you are supposed to use your insulin syringe. Let us take note, guys, that your insulin syringe is different from your tuberculin syringe. Okay, guys, ari insulin syringe. Kung makita nyo, may 10, 15, 20, 25, 30, 35, 40, 45, 50. Ito balaan nyo mag-order class ng insulin mahambal. Inject 10 units of insulin. Okay? Inject 20 units of insulin. So dira na sa, no? Now, class ang tuberculin syringe nyo pila ka ml, pila ganiya ka ml ang tuberculin syringe naton. Sige nga. Hindi na nga ako nga audience impact. Okay, 1 ml, ha? Class 1 ml. So class, your tuberculin syringe would look like this one. Sa diin tagani nga procedure ginagamit students usually ang tuberculin syringe. Diin nga procedure ginagamit ang tuberculin syringe. Okay, skin test, siguro sir sa Mantoux test, kaya another name sang Mantoux test, tuberculin test. Okay, very good. Okay, class, skin test, Mantoux test, okay, or your ano ba yung another term sang Mantoux man. May 3 letters na siya. PPD. Okay, your PPD. Purified Protein Derivative. Okay, the test for exposure to TB. So class, reminder, hindi pwede gamito ng imo nga 1 cc syringe, 1 ml syringe class in injecting of insulin. Okay, that would lead to overdosage on the part of your patient. And then students, your insulin is also considered to be a high alert medication. It's considered as a high alert medication. Okay, so bawal. What else? Pwede dumduman ko kang gina. Yung insulin, tuberculin. May pamangkot ko tani guys, ka nalipat na ko. Kaya sige lang, bunglod ko lang karok na sa lipat. Now, what are the different routes of administration? So class, the different routes of administration are subcutaneous and intravenous. Sub-Q and IV. Okay? Now class, IV is used for emergencies. Ano nga klase ka insulin ang pwede ko inject IV? Very good. That would be your regular insulin. Ha? Class, hindi pwede tanan nga insulin inject IV. Or kung tulokon yung insulin, ano itsura ya dapat? Should it be clear or cloudy? Class, it should be the clear insulin that we can inject to our patients. Ha? Clear insulin that we can inject to our patients. Okay, please take note of that. Now, what are the injection sites? Pwede outer arm, pwede abdomen, pwede buttocks, pwede upper outer thigh. Okay, so you can consider these areas. Okay, now, complications of insulin therapy. Class, ara ang mga erratic insulin reactions. Please go through them and understand them. Ha? So, okay, please read through muna while I'll be reaching for my laptop's charger. Let's resume. So students, these are erratic insulin reactions, which are some of the complications now of your insulin therapy. One is your Somogyi effect or Somogyi phenomenon also. It's referred to as rebound hyperglycemia. So class, what's happening here? The blood sugar levels is normal at bedtime. However, class, it would be decreased at 2 a.m. to 3 a.m. Okay, class, the blood sugar levels are normal at bedtime, but then class, it tends to be decreased at 2 to 3 a.m. Then ano kakatabo? There will be subsequent increase by the production of counter-regulatory hormones. Okay? So class, mahambal ng pasyente, ang common na nilang concern mahambal. Nurse, kakabugtawan, kuya bala kong kaagahon. Okay, tapos daw ginanervyos ko kag daw nagapanglipot akon ginhawa. Okay, ano ang posible nga reason sina? So class, the possible reason for that is anong kakatabo class? May ara siya sang doses sang insulin nga ginahatag kong gabi nga ang iya nga hypoglycemic effect naga-take effect at around 2 a.m. to 3 a.m. Dugangan para nila class nga, ay kakabugtawan ko kang kaagahon kung alas 3 kay ginaaswang ko guro. Yung mga amo para tanak class kay istorya pa. Okay, but class, what happens here is that there is a high dose of insulin at bedtime, and because of that, hypoglycemia is experienced by your patient early in the morning. Pag muno na yung sa nurse, mga alas 6 alas 7, pag check sa nurse normal na yung blood sugar levels ya. Kaya galit nag-rebound na to yung class ginbawi na sang hormones naton. So what would be our management for that? We need to decrease the insulin evening dose of your intermediate acting insulin, or you could also have class your bedtime snacks. Okay, class ang bedtime snack naton class, kumahambal ka, isa abi ka skyflakes, no? Amo na class ang bedtime snack sa, hindi class na may isa pa ka rice, may coke, hindi amo na. Okay, you need to educate your patient. So signs and symptoms, early morning headache, night sweats, kag nightmares. Now, dawn phenomenon, ano ga katabo? Normal ya class ang blood sugar until 3 a.m. Okay? Then there is early morning hyperglycemia nga makatabo because class of the excessive early morning release of your growth hormone and cortisol. This goes back, student, to your circadian rhythm. That goes back to your circadian rhythm. How do I put circadian rhythm simply, man? Do amo na siya class ang literal tagid nga body clock wherein in this time of the day naga-release yung hormones aton lawas. Okay, so that's your literal nga body clock. For example, mangkuton ka mo sa pharma, what's the best time to give steroids? You would say in the morning because usually our body produces steroids in the morning. So class, dili naman niya, if you can notice, growth hormone naton kag cortisol, naga-hard work man kung aga. So for that reason, naga-increase aton blood sugar levels. Now, so what would be your management? Change na naman kas ang time of injection on the evening of intermediate acting insulin from dinner time to bedtime. Okay? Instead ng dinner time mo siya hatag to bedtime. Honeymoon phase. Okay? Hindi niya class honeymoon phase ang abuse ha. Basi karon mapanumdum bala ka mo sa abuse kung nadumduman yung sa psych. Okay? Masakitanay tapos after some masakitanay. Sorry class, sa mga background noise, happy lang sila sa honeymoon phase. Okay, now class, di ba sa abuse may ara kasakitan na katabo, no? Sakiton sang husband, for example, ang wife. And then after that, what would happen, no? The tendency is that mabawi-bawi ang husband. So he would try to do his best and the like. So honeymoon phase na yan sa abuse. But in our case here sa diabetes, magambal kita nga honeymoon phase, that is disappearance of symptoms on a newly diagnosed patient with diabetes. Okay, class? Nga class kinatuduan ka mo sang honeymoon phase. Kaya oftentimes mahambal ang pasyente, kung nagligad, to doon magalain, gibal surok-surok, kung mo may diabetes ko gali. Pero after 1 month, nadula lang siya. That does not mean, guys, na na-cure ang diabetes niya. Okay? That might be actually the honeymoon phase wherein the patient is experiencing the normal phases. Okay, so you educate your patient not to stop the medications abruptly. I've read about honeymoon phase and there are literatures which would say na that's related to our hormones, that's related maybe to the coping mechanisms of our body and the like. No? Okay? Sige. May question ako nga gin-copy-paste while I was talking. I gin-paste ko man sa iya. Dali lang ha, i-paste ko to everyone. Okay. What could be the indication, sir, for injecting in the buttocks if there are other sites that are less embarrassing for the patient? Okay? Tama man no, nga sa buttocks kaya be ma-inject, no? So, what are the possible indications, class, kung if may injury kita sa other sites? Okay? Ang pinakanami gid tani nga site is abdomen. But the common site na ginagamit na gid sa area is the upper arm. Don't worry, wala man kita nagadiretso sa buttocks. Okay? So class, anong possible reason? Injury. Okay? Injury on the sites. Now, class, magigambal nga site rotation. Timambal ka, sir, magambal site rotation. What does it mean, no? It does not mean, class, nga subo nga aga, diri sa butkon, pagkatapos karon sa hapon, diri naman sa tiyan. That does not work like that. When you say, class, site rotation, when you say site rotation on the arm of your patient, you would need to rotate, no, on the arm mismo sang pasyente. For example, this morning, diri ka nag-inject. Pagka noon time, class, pwede man nga diri ka lang ma-inject. Okay? Class, 1 cm to 1 inch away would already do for your site rotation. When I talk about site rotation, guys, it does not mean na ang site rotation naton halin dire, pakadto dire sa tiyan. No, it does not work like that. Ha? 1 cm distance lang for your site rotation. Okay? Please take note of that. Now, you have your insulin resistance. So, class, insulin resistance, ano na mean sina? Daw pariho lang balas ng drug resistance ta. That, kung baga, dati-rate, nag-work sa iya ang 20 units, subong hindi na. If you would look at the description there, it says, the same or higher dose of insulin, but the blood glucose levels are not anymore responding. Okay, that's your insulin resistance. So, reminders on insulin therapy, guys. So, the reminders there are, what do you call that? Medyo ging detailed ko man na dira. Okay? Maliban na lang kung may mga pamangkot ka mo, I would entertain you for that. Ha? Tapos if you have questions on that part, feel free to post it in our GC para I will be able to answer it for everybody. Hindi maguya-huya, guys, mamangkot because some of your classmates would actually have the same question but they are just nahuya lang gid sila class no, sa mamangkot. Is there a maximum level of insulin, sir, nga pwede i-administer? Yes. And the maximum level of insulin would depend on the blood sugar of your patient. Wala ko sang arbitrary nga mahambal sa inyo nga, guys, limit lang kita sa 50 units. Wala, no? Wala. Okay? Let me check to my LBIP, my doctor, abi nga kilala. Kay if not class nag-ano kami if the blood sugar levels of your patient is very high, the next students na option that we could have is to administer it intravenously via, what do you call that? Via piggyback. So magambala ko piggyback, ginaupdan ta siya sang 90 ml nga plain NSS, tapos nakaupod da, for example, 20 units of insulin, tapos naga-flow siya. Sorry. So class, that's your piggyback, no? 90 cc of plain NSS, for example. Sige, feedbackan ka mo kung may maximum. So far, ang pinakataas siguro nga units na na-administer ko is 32 units. 32 units of insulin given at one dosing. Pero class, if you would look at pala our subcu tissues, the limit of our subcu tissues is at around 2 ml. No? The limit of our subcu tissues is at around 2 ml. Beyond that class, beyond that is already not advisable. So, dala lang, 2 ml of insulin, mga pinaka-units na siya man. That would be playing at around 50 units. Okay, that would be playing at around 50 units. Okay, sige. Isa ko ni ka-assignment, maximum insulin. Sige. Other questions class sa insulin? Sige ha, basahon nyo na karon. Pag may time kita, basahon na natin, please. Tapos if may questions, pamangkot lang sa aton ng GC. Now, class, on the mixing of the insulin, in my clinical practice, I have not mixed insulin anymore. Because guys, what is available right now is that we have specific stocks already of insulin that are pre-mixed. No? You have pre-mixed stocks of your insulin. You have pre-mixed stocks of your insulin. So wala na kami yung class 1 nga nag-mix pa sang insulin. But it has been a common question in the board examinations and then the NCLEX. So what do you do, class? The 5 steps here would just tell you that you need to administer air first to the vials that you need to extract on. But you need to extract first from the vial of the regular insulin because class, you don't want the intermediate acting insulin to contaminate the regular insulin. Okay, I would just write here on the side that the goal of this one is to prevent contamination. The goal of that one class is to prevent contamination of your regular insulin. To prevent contamination of your regular insulin. Okay, amo na siya class ang goal sining 5 steps ha. Class, base sa ibang libro, makita nyo 4 steps or 6 steps. I listed it as 5, no? And for me, that is the clear way of expressing that. Now, class, you have your insulin pump. So it's an alternate method of insulin delivery, wherein class, a device is embedded subcutaneously. Ang device class gina-attach sa skin, tapos may subcu needle nga nagasulod sa pasyente naton. And that subcu needle is the one that is monitoring the blood sugar levels and at the same time releasing insulin to the patient's body. Okay, so that's your insulin pump. And then class, you also have your jet injections. Subong class classmates. Subong guys, may ara nakita insulin pen, no? Your insulin pen, although it's a bit expensive, patients are not usually opting for this because of the price. But of course, it is more, what do you call this? It's safer, no? Compared to the administration of insulin. Nga sila mismong nagasukol-sukol, no? Which could be inaccurate. Okay? So class are, this is an insulin pen. Class ginapatuyub-tuyub na diri nga patient, sang patient sa diri nga part. Okay? Tapos mambalabi, okay, 10 units hatag yan. Tapos class, i-inject lang na sa kaugalingon niya dayon. That would be giving your patient 10 units of insulin already. Okay, that would give your patient class 10 units of insulin already. Okay, may needle na ini. Be, ay daway. Okay, so class, that would be at around, may needle na siya class na very fine needle na. Okay, sige. Oh, how many ml of air? Ml of air sa vial, no? How many ml of air sa vial? Estimate mo lang. Okay, kung mga 10 units siya, that will be less than 1 ml of air. That will be less than 1 ml of air. Or kung pila ka units ang kuhaon mo nga insulin, amo man na class ang amount sang air nga i-administer ninyo to the vial. Okay, that's also the amount of air that you will administer to the vial. Okay. Na-lost ko kung ano nga air actually. Class oral hypoglycemic agents. So class for the oral hypoglycemic agents, they have different action. They could stimulate the pancreatic cells. They could also class decrease the gluconeogenesis by the liver. Pero ang overall goal class is to decrease the blood glucose levels. Guys, ginbutang ko dira ang common gid nga oral hypoglycemic agents nga ma-encounter naton. And class, you have the different mechanisms of action there of your oral hypoglycemic agents. Now, class, din-summarize ko na ina, kay in one way or another, for example, sulfonylureas, there are studies that would say that sulfonylurea would also decrease the hepatic glucose production. Pero class, ang ginpang indicate ko dire is ang primary na nila nga mechanism of action. The primary mechanism of actions are indicated there. So oftentimes, mamangkot ang pasyente mo, nga kinahanglan ko pa i-combine ang glycoside ko sa metformin ko. And the purpose of that class is that it acts in different ways to improve your blood sugar control. It acts on different ways to improve your blood sugar control. Okay? That's how it works, no? So students, ibilin ko man ni sa inyo, these are things that you need to familiarize. Okay? Or maybe thinking that you need to memorize. Ha? These are things that you need to memorize. Wala mo kung expect na memorize, so nyo gina sila letter per letter, but at least you'll be able to know, oops, we're talking about the zones. These the zones are your thiazolidiones. So these are insulin sensitizers. Okay? At least you would know how would they be effective. Sige. Surgical management, pancreatic transplant. So it could be pancreatic transplant alone. It could be pancreatic transplant after a successful kidney transplant, or pancreatic transplant that is simultaneous with your kidney transplant. Class nga nagaupod ang pancreas kag kidney transplant, no? Other than they are near to one another, especially on the left side of the road there, class your pancreatic transplant is usually needed when your patient is already having DM nephropathy. In other words, kidney is also chronically impaired. The functioning of the kidney is already chronically impaired. For that reason, you're having pancreatic and kidney transplantation at a single instance. Now, acute complications. Okay, there are several acute complications. Okay, the most dangerous so far is your DKA and your HHNC. So you have your DKA and your HHNC. That basic. Now, class DKA. Din gani common ang DKA, type 1 or type 2? That would be more common in okay, type 1. And then HHNC would be common in type 2. No, that would be common in type 2. Now, let's talk about your DKA and then your HHNC. Now, class DKA, anong pwedeng reason? Overeating. Wala naka-take sang insulin, wala naka-inject insulin. Or class, nag-increase ang demand sang insulin, wala na meet. For example, na-stress. For example, pregnant. Or for example, may infection. Class, remember that when you are under stress, when your body is under stress, you would need more insulin. But in the case of your DKA, wala na meet ang demand for insulin. What happens? Class, look at the CBG. That is one way, class, for you to differentiate your DKA from HHNC. If you would go back, students, to the definition of your HHNC actually stands for hyperglycemic, hyperosmolar, non-ketotic coma. Okay? Hyperglycemic. Okay? Hyperosmolar, non-ketotic coma. So later on, kung dumakasandad ka mo kagapalibog ka mo kung paano siya i-differentiate, go back to these words. Hyperglycemic, hyperosmolar, non-ketotic coma. Lantawa ang duha, kay sino mas taas sugar? HHNC. Kaya hyperglycemic, gani ang isaya kapangalan. Okay? Now, class, in your DKA, you would have signs of dehydration. Okay? Fluid volume deficit, fluid shifting is the reason for that. You would have signs of ketoacidosis. If they would ask you, therefore, what is the common ABG imbalance in a patient with diabetes? What's the common ABG imbalance in a patient with diabetes? The answer for that would be May nakasend pa direct message. Okay, that would be your metabolic acidosis. Okay, metabolic acidosis. Huh? So decreased HCO3, decreased pH, and then presence of ketones in the urine. Now, class, your patient may experience increase of potassium. Plus, the increase here of potassium would go back to the pathophysiology of your acidosis. This is secondary to acidosis. Secondary to acidosis. Bakit, class? No? Bakit? Let's think about this. When I talk about hydrogen, is hydrogen positively charged or negatively charged? Positive. Okay, we agree that hydrogen is positively charged. When I talk about acidosis, what happens to the levels of hydrogen in the body? Is it increased or decreased? Very good. Acidosis, increased, no? Plus, the value of the pH is in fact decreased, but take note that pH is inverse. Inverse na yung pag-state ni pH. So, the hydrogen ions in the body are actually increased. Kadamo, gidyas ang hydrogen nga naganapta. So, class, ma-explain ko kung nagka-hyperkalemia siya. What's happening? Let's picture that this is the cell. Class, when your body is having acidosis, your body would try to resolve it. The body would resolve it by allowing hydrogen to come inside the cells. So mahambal siya, sige hydrogen, sulod diri ka nagaralapaw kadira sa sagwa. Now class, once hydrogen would get inside the cell, somebody needs to come out to balance the gradient. And since hydrogen is positively charged, what's the major cation inside the cells, guys? Ano ang major cation sa sulod sang cell? That would be your potassium. So class, wala choice si potassium, siya po ilalabas. Okay, so class, potassium levels would be increased. This is the reason why you are having hyperkalemia in acidotic conditions. Okay? Now, class, kinahambal ko na sa inyo so that if you have this condition of your patient later on, you will not be excited kag maghambal. O sige, tagai siya sang something for potassium. Hindi ta class pagdali-dalion panubo ang levels ng potassium. Because by the time na i-treat nato ng acidosis, ang potassium sang pasyente naton class mabalik na dito sa sulod. Okay? So we do not hurry on the medical management of your potassium. We manage it by managing the acidosis of your patient. Okay, take note of that. So you have also anorexia, nausea, vomiting, then you also class have your acetone breath. Acetone, dahil anong nandyan sa bloodstream, students? What particular byproduct is present in the bloodstream? That would be your ketones. So because of the presence of your ketones, guys, your patients are already having your acetone breath. Okay, your patients are already having your acetone breath. Then, characteristic also of your DKA is another K. You have your Kussmaul's respiration. Okay, Kussmaul's respiration. Plus, Kussmaul's respiration is actually an attempt of the body to excrete the carbon dioxide. So, class ang tendency na maginhawa sa ginapagwa gid class ang carbon dioxide. Okay? The coping mechanism na siya tani isang body para mapagwa ang carbon dioxide. Because remember, excess levels of carbon dioxide would equate to acidosis or alkalosis. Increased levels of carbon dioxide would actually equate to acidosis. So for that reason, ang Kussmaul coping tani isang body para mapagwa. Because remember, in your ABG, once the kidney would have the problem, plus kidney problema kay metabolic acidosis, your lungs would try to compensate. Lungs would try to compensate. Okay, then class mental status changes would occur. Okay, una-una alert, leading towards lethargy, leading towards class your coma. Okay, leading towards your coma. Okay, so that's it. Now class, let's go to your HHNC. Now class, for your HHNC, pareho lang na istorya, may dehydration. Ay ang dehydration do wala tagid masyado ginfokusan, pero this is also life threatening, guys ha. So dira ta naga fluids, no, sige hatag naton fluids. Then plus while nagahatag fluids, closely naman kina-monitor ang patient for congestion. Now lang tawa, wala ketosis, wala acidosis, wala Kussmaul, wala acetone breath. Pero class, profound dehydration lang kag neuroscience. Okay? Class, diin ay ang neuroscience nato naghalin. That is because of your hyperosmolar state. Okay, because of your hyperosmolar state, there will be shifting of fluids happening inside the brain. And because of that, class, your patient would have your neurologic signs and symptoms. Of course, okay, that's it there for that part. So, management, tanawon nyo class, nag-insulin kita. Insulin. And class, just like any other cases, hindi natin gusto that the insulin levels would abruptly decrease. We don't want the insulin levels to abruptly decrease. Class, mag-abrupt decrease ang insulin levels, pwede naman magka-cerebral edema. So class, if you can notice regular insulin, and then class, we give 5 to 10 units of continuous infusion. Now, for the fluid problem, we give your plain NSS. Okay, class, if CBG is 250 to 300, you give your D5 NSS. Nantawa ha, di ba class, ang normal natin nga CBG, hambal ta, 80 to 120. Di ba la? O, basta ka kag-intindihon. Plain NSS ko hatag ta. Pero once plus the CBG is already 250 to 300, ma-D5 kita. What does it mean, guys? Hindi naman natin gusto nga mag-abruptly decrease ang sugar levels ng pasyente ta. Kay karon plus kung nakabutang dito sugar, 700 or 800. Okay? Pag manage mo class, gulpi lang abi, nag 120, cerebral edema. Complications would again occur. So we could not allow for an abrupt decrease of your blood sugar levels. Okay? Bawal din siya class na mag-abrupt decrease si blood sugar levels. Now, acid bicarbonate would be the solution for that. Okay? Then class, for your potassium problem kang gina sa DKA, so you need to monitor potassium. Kaya ambal ko kang gina, taas siya tuod, pero class maamat-amat na siya nubo once there is management of your acidosis and dehydration. Class, you can do, tanawa, di ba ang problema ta is increase of potassium, pero tanawa, ginapreparahan natin class ang rapid K replacement pa. Kay we know that if this condition class, if the acidosis would be managed, the risk of my patient right now will be hypokalemia. That's why you also need to watch out for hypokalemia. We need to monitor class for the rapid K replacement or standby for rapid K replacement in case our patient would need. Okay, then class, monitor your level of consciousness and then your neurovital signs. Now, hypogly. Class, I would want you to take note of the signs and symptoms of hypoglycemia. Pag mag-mild class, that's usually mga less than 60. Less than 60 milligram per deciliter. Tapos, pag mag-moderate siya class, less than 40 milligram per deciliter. Pag mag-severe siya class, less than 20 milligram per deciliter. Okay? Amo na sa class kanubo ang blood sugar levels. So, if you can notice, the signs and symptoms gets to be more severe as the blood sugar levels are, of course, decreasing. Okay? So, class, what's our plan for these patients or at least for hypoglycemia? So, to prevent it, prevention is better than cure. Take the medicines on time. Okay? Take meals on time, again, class. Then, in case it would occur, 15 grams of fast-acting sugar. That would be your rescue candy, your soda. And then, class, you could administer glucagon sub-Q or IM if they have the prescription. And then, class, if still unconscious, you go back to your D50 water. Okay, D50 water. Now, class, your foot care was just indicated there to remind you that your DM foot is one also of the complications of your diabetes, which could lead towards amputation. So, dapat your patient will be able to do it properly now. Okay, will be able to do foot care properly. Now, if your patient's class will be undergoing surgery, these are our goals. Pre-op, okay, thorough regulation ng blood glucose levels. We don't want the blood glucose levels to be erratic. Kay tiklas ang iya karon nga risk for complications nagataas. Then what we would do? Constant monitoring of BS and then frequent labs and bedside glucose studies. Inter-op class during the surgery, regular insulin is being practiced. Okay, so class, it's based on the blood glucose levels of the patient. Oftentimes in the clinical setting, you would look at that as insulin sliding scale. They would usually say insulin sliding scale. Kasi hindi ako sure sa exact values pero tagaan lang ka mo example. Mambalabi, less than 150, hindi magatag insulin. 150 to 170, give 2 units of insulin. 171 to 190, give 3 units of insulin. 191 to 210, give 4 units of insulin. Okay? In other words, class, nakabase sa values ng insulin, nakabase sa values ng blood sugar, ang insulin management natin sa pasyente natin. Okay? Now, class, in the OR, they do not usually do it sub-Q. Kaya mabudlay class i-control ang sub-Q nga dose ng insulin sa OR. Because in the OR, your patient may be actually attached to a bypass machine. When I say bypass machine, guys, the blood flow would flow towards another machine. Let's say, for example, in heart surgery. So, class mabudlay, i-maintain na ron ang blood flow pakadto sa fats. No? So, there might be decreased absorption of your insulin. So, for that reason, we usually give IV insulin doses when you are doing it in the OR setting. Post-op, for stabilization of your patients. Okay, guys, those are our topics that's the end of our topics for endocrine disorders. Unless you would have questions, sige, you're free to chat your questions and then to raise your questions if you would want to. Hello, sir. In terms of candy, is it true that peppermint candy should be avoided as rescue candies? I'm not so sure that they need to be avoided, but I think they're not good sources. No, they're not good sources of sugar. Your peppermint candies are not good sources of sugar. So yeah, sweet candies for that. Sige. Okay. Let's pause.